Okay. Hello. बसा मॅडम. गुड. तुम्ही सगळ्यात पुढे आहात. एकदम पुढे. येस. फर्स्ट बेंचर तुम्ही आहात ना कायम. ओके. थोडंसं पुढे झालं राईट. मध्ये एक जागा आहे. नाही चालेल. Okay. Now today there is a movie on ECG. This is what we can think. Why we see movie? Because it's going to take almost a movie time, 2.5 to 3 hours, and be prepared. And we will also have an interval in between, without popcorns or. But there's a thing. If you think to have an interval in between, let me know. We are trying to make it a little more conceptual. Karan, everyone requires to know about an ECG. Even it is an even if it is a student, even if it is a practitioner, even patients want to know the ECG, because what we are seeing on our videos are being seen by 60% videos are seen by students. ECG videos are seen by students, uh, and also the patients, and also the patients. Now get settled because link break होते माझे मध्ये मध्ये. Yeah. After some time we're going to lock the room. Nobody can go out, not even me. Now, I'll spend 10 minutes on the importance of knowing about an ECG. किती जण येऊ शकतात? 5 जण बसू शकाल? If it is possible. Yes? If it is possible. Okay, 5 जण. Because हां मागे पण एक जागा आहे. 5 जण बसा. अजून चेअर्स आहेत आपण टाकूया आपण आफ्टर सम टाइम. आफ्टर सम टाइम. बस 2 किंवा 3 मॅक्सिमम. नाही. इनकन्व्हिनियन्स होईल. इनकन्व्हिनियन्स. हां इथे पण फर्स्ट बेंचवर पण बसू शकतात, काय प्रॉब्लेम नाही. बसा. अजून काही चेअर्स मी ओपन करीन आफ्टर सम टाइम. आफ्टर सम टाइम यू कॅन से. आणि एकदा लिंक लागली की मग ती ब्रेक होणार आफ्टर सम टाइम. ओके. नाव वी आर गोइंग टू डिस्कस ECG in a conceptual way. Now remember there is an importance because you see lot of videos are there. The videos will give an idea about एक किंवा दोन जास्तीत जास्त. बापरे कुठे बसणार? हाच प्रॉब्लेम होतो ऍक्च्युली. ऐक ना चेअर्स दे अजून. पण कुठे बसणार? चेअर्स आहेत पण जागा नाही. जागा नाही. दॅट इज व्हॉट इज द प्रॉब्लेम. नाही पण कसं कुठे बसणार? हां आहेत जागा आहे पण बरी. सर बॅग घेऊन जाईल खाली. ती बॅग घेता येईल खाली. किती लोक आहेत रे? आपले रेग्युलर लोकच आहेत. तुम्हाला लवकर मध्ये जागा ठेव. हां पुश इट. आय डोंट थिंक सो. मागे जागा आहे. ते मागे 3 जागा आहेत. सगळ्यात मागे 3 जागा आहेत. हां सगळ्यात मागे. हां सगळ्यात मागे 3 जागा आहेत. आता ऑक्सिजन पण कमी होईल. नाही ठीक आहे. नाही आता नाही ठीक आहे. वी आर गोइंग टू शेअर द रेकॉर्डेड व्हिडिओ विथ यू. दॅट इज व्हॉट इज अ प्लॅन. बिकॉज लॉट ऑफ स्टुडंट ऑलमोस्ट 30-40 स्टुडंटला मी नाही सांगितलं. मागे जागा आहे का मागे? इथे किती जण आहेत? 1 2 3 4. हे 3 चेअर आहेत पण कसं तरी आपल्याला ऍडजस्ट. इथे एक बस. इथे 3 चेअर आहेत. अनफॉर्च्युनेटली इथे एक आहे, इथे एक आहे, इथे एक आहे. झाले ऍडजस्ट एवढे? होईल ना? ओके ना इथे बस. अजून एक स्पेशल चेअर आहे पण ते नंतर उघडणार मी. हे ठीक आहे हरकत नाही. इवन इफ यू डोंट राईट एनिथिंग टुडे गुड. तुझ्याकडे ठेव. You don't write anything today. Now remember, let's come back. Now we are going to learn ECG in a conceptual. Now remember, what is the concept? Because you must have seen my X-ray video कोणी बघितला माझा YouTube वरचा. Remember how to learn X-ray, because X-ray is all black and white, बरोबर ना? So if there are various videos on YouTube or various books which say, okay, pneumonia X-ray looks like this, tuberculosis X-ray looks like this, but what is the concept? What looks black, what looks white? हे जर आपल्याला कळलं, तुला नाही लागा. नाही आता ऍडजस्ट होणार नाही. काय करू शकतो बघ, मी तुम्ही नंबर देऊन ठेवा, मी व्हिडिओ शेअर करतो, मी रेकॉर्ड करतो. नाही त्यांच्याकडे नंबर घेऊन टाक, आता गरज नाही होणार. कारण आपल्याला in time we will have to finish. We will also have to finish. Now, so what is the concept? What looks black? What looks white? If you know what looks black, what looks white, you can have your own diagnosis in the, because no X-ray is similar. For example, we all know that solids looks white in the X-ray, air looks black in the X-ray. If something which is between solid and air, it will look gray. Something which is more solid than gray, it will look more black than gray. It's as simple as that. So if you know this, even we can learn X-ray in 30 minutes. You just have to know what is a normal X-ray looks like. If something looks more dark, that means it has got more air in it. If something looks more white than normal, then it is more solid in it. So if you understand this concept, X-rays becomes more interesting, because you exactly know what looks black, what looks white in that. Now, we can also apply the same principle in ECG, because there are various videos in the on YouTube. Learn ECG in 2 hours, learn ECG in 3 hours. Books also learn ECG in 7 days. Atrial fibrillation looks like this. Ventricular hypertrophy looks like this. MI looks like this. But what is the concept of ECG? Now remember, just like in X-ray we have black and white, just like in X-ray we have black and white, what we have in the ECG as a concept is the positive wave and a negative wave. So let's go into this. Because if something is normal is positive, now if the wave is negative, then that means there's some problem. But when it will be positive, when it will be negative, that is what is a concept. And if you understand this, believe me, it is all rooted in 11th and 12th standard. ECG आपल्याला वाटतं की ECG is the super specialty. But the principles of ECG is 11th and 12th standard. And I'm going to go through that principles right now in maybe 15-20 minutes. Then we will go to the normal ECG pattern. Then we will go to the normal ECG paper. Then we'll go to abnormal waves in the ECG. It's a huge data we're going to cover today. And if you're audio recording it, well and good. I don't have any problem. Video recorded file I'm going to share with you if it is getting recorded properly. All depends upon that. Parantu, today we're going to learn the mechanics in the X-ray, ECG, sorry. That means what is positive wave, what is negative wave. Now remember, I talked about principles in the 11th and 12th standard. Now those principles in the 11th and 12th standard is the principles of electromagnetism. Electromagnetic wave. Let's say for example, काय होतं? If you remember in 11th and 12th standard, there is something that generates the current. त्याला काय म्हणतो आपण? Generator. See, if you remember physics, electromagnetism, there's something that generates the current. There is some electrode that is measuring the current produced by the generator. एक voltmeter असतं, त्याला काय म्हणतो आपण? Voltmeter. Now, what does the principle says? This principle of electromagnetic conduction, if the current is coming towards the electrode, it is a positive wave. Basic principle. If you remember, there was a voltmeter like this, there was a 0 here, and there was -1, -2, +1, +2. The pointer is here. The pointer moves towards positive, that means current is coming towards the electrode. So, what the first principle of electromagnetic conduction says, if the wave, or I can say current, is coming towards, what did I say? कुठली wave मिळते आपल्याला? Positive wave. Or I can say upward deflection. I can say upward deflection is a positive wave. If the current is going away, काय मिळतं आपल्याला? Downward deflection or a negative deflection. Now remember what it has to do with the ECG. If you must have seen ECG is being recorded, there is a pointer and the paper runs in front of it. बरोबर? The pointer is just moving up and down. Pointer काय करतो? Just moves up and down. The paper runs in front of it. The pointer is moving up and down. The paper is running in front of it. It produces a graph, and that is what is called an electrocardiograph. Now, when should pointer move up? When should pointer move down? Depends upon this. And another important thing you must understand that how much pointer moves upward or downward. किती move होतोय? That is proportional to the current. That means +1 म्हणजे काय? थोडा current coming towards. +2 is what? जास्ती current coming towards. -1 is what? थोडा current going away. -2 is what? जास्ती current going away. So second important principle you must understand that amount of deflection. Let me have eraser. तुम्ही काय write करू नका. Amount of deflection is proportional to the amount of current. दोन principle आपण लक्षात घेतले. This is we have started from the 11th and 12th standard. What does the principle says? If the current coming towards it is positive, the current going away it is negative. If the amount of that means more current coming towards, it will be more positive wave or a tall positive wave. If the more current going away, it will be deep negative wave. Deep negative wave. So if you understand this, some things becomes clear because all of you know that there is PQRST complex, right? If you say P is a positive wave, right? Q is a negative wave. R is a positive wave. Something going up is a positive. S is a negative wave. This is an isoelectric line. No current is flowing. Because remember, pointer is this. If the pointer moves slowly up and down, it produces this wave. The pointer moves sharp up and down, produces this wave. Pointer doesn't move at all, produces. Pointer moves upwards, produces. So if you see this, the paper running in front of it, and the pointer is moving up and down, and this up and down is proportional to what? Current coming towards or going away first, and the amount of current. And the amount of current. इथपर्यंत लक्षात आलं? So this is what is the physics part of this. Now let's apply this principle in cardiology. In cardiology, let's say for example, first thing you must understand that ECG is a graph. आपण काय म्हणतो? Electrocardiograph. Now any graph, all of us know, has got two parameters, x-axis and y-axis. So let's understand what is x-axis in ECG, what is y-axis in the ECG. Now remember, electrocardiograph has got, we all have understood that there is a pointer that moves up and down. That pointer is moving in which axis? X-axis or y-axis? Y-axis. आपण कुठलाही ग्राफ जेव्हा काढतो, this is x-axis, this is y-axis. So the pointer is moving up and down. That means on y-axis, what do we have? Current or amount of current. जिथे पण तुमची गाडी अडणार, प्लीज मला अडवा, because everything is going to climb on each other. This should be understood like a story. Because if you miss in between, पुढचं थोडंसं समजणं difficult होईल, because this is what we are compiling many more things together, and your interaction is going to make it more understandable and beautiful. So pointer is moving up and down. Pointer moves up and down with respect to what? Current. So what is there on the y-axis? Amount of current. What is there on the x-axis? Paper is moving, right? The paper is moving at particular speed. Now remember, graph कसा पण produce होईल. What are the two things that's going to decide the graph? X-axis and y-axis. That means how much is the deflection on the y-axis is going to decide the graph. Secondly, the graph will be decided by the speed of paper. The paper is moving slowly, all waves will be close to each other. The paper is moving fast, all waves will be away from each other. So to universally acceptable manner, there is a speed of paper is fixed all over world. And what is there on the x-axis is the speed, or what we can say time, because speed is measured in with respect to time. Now let's say you must have all seen the ECG paper. Let's say this is what is an ECG report patient comes to you with. And all of us know that ECG paper is, let's understand the ECG paper right now. There are boxes like this, right? Now all these boxes you must have seen properly is again further divided into 2, 3, 4 and 5. Every, now blue one is a big box, is further divided into 1, 2, 3, 4, 5, 1, 2, 3, 4, 5 as a small boxes. Now which one is an x-axis in this? This one is the x-axis. Which one is the y-axis? All these are the y-axis. So understand, it is the electrocardiograph. Graph has got x-axis and y-axis. So what is on the x-axis? Speed. What is on the y-axis? Current, amount of deflection. Let's understand the paper right now. Now, whole paper is divided into big boxes which are dark in color and small boxes which are little light in color. I have used two colors right now. Now remember, to universally acceptable way, the speed of the paper on the x-axis. Speed कुठल्या paper कुठल्या axis वर येईल? X-axis वर. Now speed of the paper is fixed. That is about किती? 300 big boxes per minute. किती? 300 big box. That means this is one big box. 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 That means paper runs at the rate of 300 big boxes per minute. Now let's first understand the value of these big boxes and small boxes, because what is a normal ECG is all depends upon P wave किती duration ची आहे, QRS complex किती duration चा आहे, ST segment किती duration चा आहे आणि किती deflection आहे. So you will have to understand what is the value of this one box, so that we can understand whether the ECG is normal or not, because every wave is measured in two axes, x-axis and y-axis. How do you know P wave is normal? If it is x-axis पे normal है और y-axis पे normal है तो P wave normal है. So this 300 big boxes per minute, that means what will be the value of one box? 1 minute has got 60 seconds, right? And 300 will be, बरोबर ना, mathematics. We are poor in mathematics, so we choose medical field. So one big box is equal to किती? You can use calculators. 1 by 5 म्हणजे किती होतात? 0.2. That means on the x-axis, this particular segment is, now this is very important to understand, because how do you know? You must have heard about PR interval. किती PR interval normal असतो? 0.2 seconds. कसं काय 0.2 कळेल आपल्याला? One big box. QRS complex should not be more than 0.1 second. कसं कळेल? Looking at this. So x-axis पे, what is the value of one big box? Let me write it here. One big box is equal to 0.2 second. Anybody? It's difficult to understand one big box value. What is the speed of the paper? 300 big boxes per minute. म्हणजे 300 big boxes per 60 seconds. 60 सेकंदामध्ये 300 बॉक्सेस धावतायत. म्हणजे 5 बिग बॉक्सेस धावतायत एका सेकंदामध्ये. बरोबर ना? म्हणजेच एक बिग बॉक्सची व्हॅल्यू आहे 1 divided by 5 is 0.2. हा 0.2 कसा आला? Speed of the paper नुसार. Now this 0.2 is a value of what? One big box. With this we can also derive the value of this small box, because one small box आता किती असेल? या 0.2 मध्ये 5 आहेत ना? 0.2 divided by, it becomes 0.0. Now don't ask me कि 0.04 is bigger than 0.2, because 4 is bigger than 2, but there are two decimals in it. It's mathematics. नाही कळलं? हाँ. 0.2 is equal to 2 by 10. 0.04 is equal to 4/100 बरोबर ना. ठीक आहे, मी मॅथमॅटिक्स मध्ये जात नाही. We can directly, I'm going to write all formulas here because प्रत्येक everything will be related to this. This is what, if you understand x axis पे कितना है, y axis पे कितना है, we understand all the ECGs and we can derive your own opinion की या ECG मध्ये काय प्रॉब्लेम असेल. पुन्हा एकदा बघूया. What are the principles we have learned till now? We have learned about current. If the current is coming towards the electrode, it is a positive wave. Current going away, it is a negative wave. Amount of deflection is proportional to amount of current. That means more current going towards, more positive wave. More current going away, more negative wave. And we also have understood that the ECG paper on the x-axis, the measurements on the x-axis are one big box is equal to 0.2 seconds. One small box is equal to 0.04 seconds. 0.04 seconds. इथपर्यंत लक्षात आलं? Now, before we derive any conclusions from the ECG, now remember, ECG is one of the most important things we all want to learn. But remember that ECG has got several flaws. You must understand. नाही आपण उभं राहायला पण तयार आहे. उभं कसं राहणार आता? आणि दोन सायन्सचे पण बस थांबले. नाही पण उभं कुठे राहणार ना? उभं कुठे राहणार ना? मागच्या नाही दिसणार नाही. नाही ग. माझे टॉयलेट आहे डायरेक्ट. हाँ एक बघ, वन काइंड हार्टेड पर्सन. मी रेकॉर्डेड फाईल शेअर करणार आहे सगळ्यांना. पण मी बऱ्याच जणांना नाही म्हटलं, पण नाही हा नाही, पण आता झालेच सगळे ऑलरेडी सगळे. हा नितीन सर तिथे आहे एक जागा, एक सरांना बसू दे. ओके फाईन, नो प्रॉब्लेम. एक तुम्हाला ते उभं राहाल तुम्ही, चालेल? हां चालेल, ठीक आहे. पण प्लीज, थँक्यू सो मच, थँक्यू सो मच. ठीक आहे. हां बॅग बाहेरच ठेवा. चालेल, उभे राहा. थँक्यू सो मच सर, अप्रिशिएट दॅट. हे आता चला ठीक आहे. नाही ठीक आहे, नाही आता नको, तर नाही होणार. ओके, मध्ये मध्ये आपण कसं ट्रेन मध्ये जागा देतो, तुम्ही बसून घ्या. म्हणजे बदलापूर ते ठाणे एक जण बसेल, नंतर अजून ठाणे ते पुढे. ओके, now let's summarize for those who came just now. We have learned about certain principles in the ECG. Now remember, the whole ECG stands on these principles, which is written on here. Current. Now what is producing current in the ECG? It's the heart. Remember, we have several investigations in medicine where we measure the current. Like for example, ECG is a current measured by, produced by heart. We also have EEG, current produced by brain. We also have electromyograph, current produced by the muscles. We also have nerve conduction studies, current produced by the nerves. So this investigation has made revolution in the diagnostic medicine, so that we can understand what is happening with the organ. So here we have understood that if something is producing current and there is a measuring electrode, if the current is coming towards, it is positive, away negative, deflection proportional to amount of current. And we have understood the x-axis has got speed, that is what is time, and this is what in the ECG paper, which has got x-axis and the y-axis. X-axis ka measurement is 300 big boxes per 60 seconds. That is what is the speed which is universally acceptable. So one big box is equal to 0.2 seconds. That means the value or the measurement of this one big box is 0.2 seconds. Now this, everything in ECG, normal or abnormal, depends upon this. And With this, we also have derived the value of one small box because this one big box has got five small boxes. So 0.04 seconds. And let's understand the y-axis ka measurements also. Y-axis पर कहाँ है? What do we have y-axis? Amount of current. So they say two big boxes is equal to zero point 0.1 millivolts. Two big boxes is equal to zero point 0.1 millivolts. Two big boxes is equal to zero point 0.1 millivolts. So everything in the ECG will depend upon this. Now, before we make a statement on ECG, remember, practitioners will definitely support me that a lot of times there is normal ECG, but patient has got a big problem in the heart. Also, a lot of times there can be a big problem in the ECG, but the patient is normal. Now, because of that, any ECG has to be clinically correlated. Patient has got no chest pain, absolutely healthy person can have an ST segment elevation or depression. But we'll have to, because 30% times ECG is normal, but patient has got big problem. And also 30% times patient is having a big problem, but the ECG is normal. So ECG is not the diagnostic test. ECG is the screening test. Because the most common problem patient comes to you in a common OPD or general practice is chest pain. How do you know this chest pain may not be related to heart? Take out an ECG. So everybody has to understand ECG. Because if the patient with chest pain goes to a cardiologist, what will happen? काय होतं आपल्या सगळ्यांना माहिती आहे. Cardiologist admits the patient, does all those investigations, 2D, cone, stress test, because if you give your bike to a service center, he will open everything and he will join everything. राईट बट नॉर्मली काय असतं प्रॉब्लेम असतो आपण कुठे जातो लोकल मेकॅनिक कडे जातो तो 5 मिनिटात एक स्क्रू टाईट करून प्रॉब्लेम सॉल्व्ह करतो सो if the patient goes to and we're not saying cardiologists are wrong but they have experience even if the possibility is 1.1% they will have to rule that out so 30% time patient is having normal ECG but abnormal pathology and abnormal pathology पण असेल तरी ECG normal येऊ शकतो So because of that, ECG has got less diagnostic value. But ECG is an entry point to all cardiac problems. And believe me, ECG not only diagnoses the electrical problems because ECG मध्ये आपण काय बघतोय मेजर करतोय करंट So primarily आपल्याला वाटतं की ECG diagnoses only electrical problem of the heart, like for example arrhythmias. But ECG also diagnoses lot of other problems. That is what we're going to learn right now. Heart मध्ये काही जरी झालं, we understand by an ECG, but you will have to understand it. We will have to look forward for that pathology in it. तो कारण जोपर्यंत आपल्याला माहित नसतं तोपर्यंत आपण ते बघत नाही. We always say eyes will not see what mind doesn't know. त्यामुळे आपल्याला माहिती असेल तरच आपल्याला ते दिसतं. माहिती नसेल तर ते दिसणार नाही. So let's go ahead after this principle so that we can understand everything which is related to heart. Now, let's say how are the waves produced? And in this 10 to 15 minutes, I'm going to explain you the cardiac cycle. In that cardiac cycle, what are the events in the cardiac cycle and what exactly are the waves produced by those events? म्हणजे normal ECG आपण थोड्या वेळात बघूया. Now, before we go, we have understood that 11th standard मध्ये आपल्याला काय होतं? There was a generator and there was electrode. बरोबर ना? हे सगळं. There was a generator and there was electrode. Current coming towards it is positive way. Going away it is negative way. Now let's first make the generator as the heart and this electrode in the ECG is called as, what is it called as? Leads. Now we don't have only one electrode. Now we always say what is happening in the heart is measured by the leads. Now we relate this heart like a cricket match ka pitch and we relate these leads with the cameras. Now let's understand it. What is heart related to? A cricket ka pitch and what is leads are the cameras. Now what is happening in the cricket pitch? Is it possible to see with only one camera? Because it is only one camera, let's say camera is coming from behind, I am catching the ball like this, it is not will not be seen properly. So we don't require only one lead, we require several leads which are covering or which are seeing the heart from all sides. So we have total 12 leads. And if you see properly, any ECG report has got all 12 leads plotted. Now, let me explain you what are those cameras and why do we require so many cameras? Because we want to see exactly what is happening in the heart from all sides of the heart. So we can आपल्याला बघायचं की what exactly is happening. Let's say, for example, if the electrode is here, it's going to face the left side of the heart, right? So it's going to measure more things which are on the left side, but या side त्याला एवढं दिसणार नाही. So we require leads which are covering the heart from all sides. So what are those 12 leads? याच्यामधले you must have, let's say for example, थोडंसं physiology. Let's say this is what is a patient, and this is where the patient's heart is. Now initially, now we have must have heard about थोडं theoretical आहे, bipolar leads and unipolar leads. No, माहित असेल? Okay. So what are bipolar? Bipolar has got two ends, positive and negative, and unipolar has got only one lead, but one pole, but the other pole is there in the machine. That's how the current is completed. So let's say we have, they take right arm, and left leg, and these three things are joined together with the help of electrodes. Let's say this is what is right arm, left leg, and left leg, right arm. And theoretical way, this is what is called an enthogran's triangle. मला कदाचित theoretically. Now this is what is lead 1, lead 2, and lead 3. So in the 12 leads, we have first lead called a limb leads, which are 1, 2, and 3. Where is lead 1? Connecting right arm and left arm. What is lead 2? Left arm and left leg. Right arm and left leg is lead 3. Is lead 3. Now याच्यामध्ये हे bipolar आहे, त्यामुळे हे positive negative, negative positive, positive negative असं काहीतरी असणार. Now these limb leads, so all these three leads are looking at the cricket pitch. बरोबर ना? Whatever is happening in the heart will be seen by lead 1, lead 2, and lead 3 together. Of course, सगळ्या तिघ कॅमेऱ्यामध्ये सेम थिंग रेकॉर्ड होईल, राईट? पण सेम फेस रेकॉर्ड होईल का? नाही. So all three leads will show the same cardiac activity but shows different waves. कारण का? कारण सगळे कॅमेरे जे वेगवेगळ्या ठिकाणी फेस झाले. Let's say for example, I am catching the ball from this side and the camera is in front. It's going to take my face also and the hand also. पण सेम कॅच घेतोय पण कॅमेरा इकडनं असणार, तर रेकॉर्डिंग वेगळं होईल पण ऍक्टिव्हिटी तीच असेल. So if you see properly, lead 1, lead 2, and lead 3 record the same cardiac activity but has got different wave pattern. कारण का? Because all the three leads are looking at different angles. त्यामुळे lead 1, lead 2, lead 3, we have three leads. Now we also have something called as augmented leads. हे मी थोडंसं स्मॉल अक्षर मध्ये लिहितो कारण हे theoretically important आहे. But you must understand what are those 12 leads. 12 leads कुठले आहेत? हे पॉझिटिव्ह निगेटिव्ह जे हेच रेसिप्रोकल केलं, निगेटिव्ह अँड पॉझिटिव्ह. See for example, whenever a photographer is giving you print of the photo, he sees the photograph in both the things, negative and positive. तुम लहानपणी इफ यू हॅव अ पासपोर्ट साईज फोटो तो तुम्हाला एक ब्लू प्रिंट द्यायचा, राईट? त्याच्यामध्ये सगळं उलट असायचं. केस सगळे पांढरे, दात एकदम काळा, फॉर एक्झाम्पल. सो ऑल दोज थिंग्स, दॅट इज व्हॉट इज कॉल्ड रेसिप्रोकल लीड्स. कारण तसं केलं तर आपल्याला पिक्चर मध्ये क्लॅरिटी अजून जास्त चांगली दिसते. दॅट इज व्हॉट इज इलेक्ट्रिकल वे ऑफ एक्सप्लेनिंग दॅट. सो ऑगमेंटेड लीड इज ऑल्सो कॉल्ड एज रेसिप्रोकल लीड्स. कारण त्याच्यामध्ये करंट उलटा करतात ते लोक. Current is reversed. So if the current is reversed, if there is a wave like this, in the reverse current it will look like this, just like a photographer. So negative image is what we can say. So if this is what is a regular electrical current, if you have a reciprocal lead, it look reverse. It will look. If you see in the ECG, पुढचे तीन लीड जे आहेत AVR, AVL, AVF, त्याच्यामध्ये सगळ्या वेव्ह उलट्या दिसतात, राईट? कारण का? कारण ते रेसिप्रोकल लीड्स आहेत. बिकॉज अँड दिस इज व्हॉट इज AVR, AVL, and AVF. R stands for right arm, left stands for left arm, F stands for foot. In AVR, AVL, AVF, we have also called as reciprocal leads. also called as reciprocal leads. So 12 lead मधले 6 leads are bipolar leads. बरोबर ना? त्या bipolar मधले 1, 2, 3 is direct leads and AVR, AVL, AVF is reciprocal leads. If you see properly, 1, 2, 3 मधले waves is AVR, AVL, AVF मध्ये उलटे असतात. It just gives an additional information. त्याला काही एवढं जास्त महत्व नाहीये, but it gives you additional information. Now what they have commented that all these leads, if you see properly, are they very near to the heart or away from the heart? Away from the heart. So why we relate this with the cricket pitch? Because recently you must have seen there is a camera in the umpire's hat. There is a camera in the stump. There is also drone cameras. What are those cameras doing? They are looking at the pitch from very close manner. So we also have the other 6 leads, which are called as chest leads. When every lead has got their own importance. Every lead will have their own importance. So let's go through what are the chest leads and where are they placed. Remember, placement of these leads is most important. बऱ्याच वेळा काय होतं, leads are not placed properly and that gives you wrong diagnosis. Because lead तुम्ही कुठे लावताय त्यानुसार तो करंट मेजर करणार. लीड जर रॉंग ठिकाणी लावला तर काय होईल? करंट विल बी मेजर्ड इन अ डिफरंट वे. सो ईसीजी कसा निघतो कोणावर डिपेंड आहे? टेक्निशियनवर डिपेंड आहे. टेक्निशियनला घाई असेल तर ECG report can be abnormal. That is what is also a lot of flaws in the ECG. So let's understand the cameras. Lead 1, 2, 3 कुठे? Right arm, left arm and left leg च्या मध्ये. Reciprocal leads are current is reversed. Now the ventral leads are V1 to V6. But where are they placed? Let's understand it. This is what is the manubrium. This is what is the sternum. The placement of this is most important because I haven't started any ECG right now. परंतु हेच सगळं प्रिन्सिपल लावले तर ECG complete झाला. Because this is what is about nuts and bolts about an ECG. The heart, if you see, heart is more on the left side than the right side. Right border of the heart is retrosternal. Apex bit is lower most and latermost part of the heart. Fourth intercostal space वगैरह वगैरह. So let's understand. हे leads जे आहेत हे कुठे लावतो आपण? These are the ventral leads, also called as chest leads, which are directly applied on the heart, on the precordium rather, not on the heart, but the precordium. In this, V1, now you may write it down, this is very careful. V1 is placed on the fourth intercostal space, right side of the sternum. Now, believe me, ECG कसा दिसतो, everything is dependent upon this. V1 कुठे लावलाय? Fourth intercostal space, right side of the sternum. V2 is placed same intercostal space on the left side of the sternum. That means V2 is here. V2 is here. Now V4 is placed on the apex bit. कुठे असतं apex bit? Lowermost left. The fifth intercostal space, 2.5 centimeters away from the sternum, on the left side or just below the nipple is what we can say. Apex bit. V3 राहिला ना? V3 is in between V2 and V4. V3 is between V2 and V4. V5 and V6 are placed in the same intercostal space. V5 in the anterior axillary line and V6 in the mid axillary line. Fifth intercostal space. Now this is very important to understand this. It is very important to understand this pattern. V1 कुठे आहे? Right side of the sternum. 4. If you see anatomy properly, V1 कोणाकडे बघतोय? ATM मागे असतं. V1 looking at right ventricle. V2 septum. V2 and V3 looking at the interventricular septum. V4 is looking at the left ventricle. And V5 and V6 अगेन लुकिंग एट द लेफ्ट वेंट्रिकल, पण सगळ्यात इम्पॉर्टंट चेंबर कुठलं आहे? लेफ्ट वेंट्रिकल. बिकॉज कार्डियक आउटपुट कशामुळे असतो? लेफ्ट वेंट्रिकल. एम आय कुठे होतात? लेफ्ट वेंट्रिकल. सगळ्यात पहिले चेंबर हायपोट्रोफी कुठलं होतं? सगळ्यात मोस्ट इम्पॉर्टंट व्हॉल्व्युलर प्रॉब्लेम कुठे होतात? लेफ्ट साइड. So we have more things on the left side. Why do we have nothing on the atrias? Because people don't die because of atrias. People die because of ventricles. And atrias are thin wall, thick wall. Thin wall. So they don't produce so much current. So ECG मध्ये तेवढे दिसणार नाही. Even if atrias are not contracting, patient will be alive or dead? Alive. Atrial fibrillation. Atria do not contract, but patient do not. Ventricle do not contract. Patient will die on the spot. So we have seen more things on the left side. We are seeing more things which are seen or leads which are placed. Cardiologists may also, can we go more near to the heart? अजून जवळ जाऊया. म्हणजे बॅट्समनच्या बॅट मध्येच कॅमेरा टाकून ठेवूया, नाही दिसणार, काही दिसणार नाही, राईट? But if cardiologists ask for, they also go for trans-esophageal lead. There's an electrode which is passed through esophagus, and esophagus is sitting on the heart, right? Posterior to it. But तेवढं एक कार्डिओलॉजिस्ट पॉईंट ऑफ व्ह्यू, तेवढी काही गरज लागणार आपल्याला नाही. इथपर्यंत आपल्याला फर्स्ट अंपायर, सेकंड अंपायर, थर्ड अंपायर पण येऊन गेला. फोर्थ अंपायरची गरज लागत आपल्या लेवलला कदाचित लागणार नाही. पण लेट्स सी V1 कुठे? फोर्थ इंटरकॉर्सल. सो V1 मध्ये जे वेव्स मिळत आहेत ते जास्ती कोणामुळे मिळतील? राईट वेंट्रिकलमुळे. हे आपण का केलं? कारण आपल्याला सगळीकडनं बघायचं आहे की व्हॉट इज हॅपनिंग इन द हार्ट. Let's summarize the leads in 2 minutes. What are we? How many leads we have? 12 leads. 3 are the limb leads, 3 are the augmented leads, and 6 are the chest leads. Chest leads are unipolar leads, where we don't need to apply two things. We apply only one thing, and the neutral point is in the machine. V1 is on the right side, V2 on the left side, V4 on the apex bit, V3 in between, V5 and V6 are in the mid axillary line and anterior axillary line. Mid axillary and anterior axillary line. Looking into this, now do we have to see all the leads for the pathology? Yes. But primarily to enter into the cardiology, how are the waves produced? We're looking at one lead and we understand the wave pattern. If you see properly, again, a cricket match, camera can wander here and there. But whenever the batsman is bowling the ball, camera kude asto? There is only one camera that is above the bowler, which shows you bowler, which shows you umpire, which also shows you batsman, and shows you the wicket keeper. बरोबर ना? बॉल कुठे जरी मारला तर कॅमेरा दुसरा जाणार, पण जेव्हा मेन कॅमेरा कुठे असतो, तो कॅमेरा की जो आपल्याला सगळ्या ऍक्टिव्हिटीज दाखवतोय, तो कॅमेरा कुठला याच्यामध्ये? दॅट कॅमेरा इज लीड टू. यू मस्ट अंडरस्टँड दॅट मोस्ट इम्पॉर्टंट कॅमेरा इन द ECG इज लीड टू. अँड लीड टू कुठे बघतोय? लेट मी अंडरस्टँड, हा कुठला लीड टू आहे ना? सो लीड टू इज हिअर. लीड टू कुठे आहे? Is here. So let's understand the wave pattern. If you want to see properly all the waves properly, look in the lead 2. Now you must see in all ECGs, lead 2 is long. खाली दिलेला असतो. तुम्हाला rhythm बघायची असेल तर, there's a long rhythm is always a lead 2, because lead 2 is the main camera which shows you many activities properly. So let's understand the pattern of waves produced in the lead 2 with respect to the cardiac cycle. म्हणजेच let's understand the normal PQRST complex. Normal कळला की abnormal, that is what is, and you must understand that normal pattern will be depending upon this. Lead to कुठे? Now if you apply these principles, you will exactly understand why P wave is a positive wave, why QRS complex is positive and negative together, why ST segment is isoelectric, and why the PR interval is also isoelectric, and why there is a T wave. We will, if you know the reason for all waves, you have mastered ECG. But you will have to see 100 or 200 ECGs as a practice. Current ECG, we don't see same type of ECG in all MIs. It's a different patterns. So you will also have to see 100-200 ECGs. बघत राहायचं, बघत, मग तुम्हाला कळतं की नाही हे नॉर्मल असेल. Initially when we see when we have taught an ECG in the other lecture we take on practice ECGs. When I show one ECG, and if you go and apply all those principles in a microscopic way, you will find that arrhythmia is there in the patient. Yes. You will see that MI is there in the patient. Yes. You will see ventricular is also hypertrophied in the patient. Yes. You will see PR interval is also problem. So all pathology in the patient is there in the ECG, but patient is normal. म्हणजेच काय ECG need to be practiced more and more because we don't see ECG in an objective way. एकदम भिंग लावून बसून बघत बसाल तर सगळं प्रॉब्लेम होणार. You will also have to relate clinical relations with an ECG. So we are here right now. What are we looking at? We are looking at lead 2 and we are understanding the wave pattern. Now understand, हे मी असंच ठेवणार आहे शेवटपर्यंत. Now let's understand the cardiac cycle. थोडंसं मी या ठिकाणीच गोंधळ करतो मग मोठं करणार त्याला. How exactly the cardiac cycle is initiated? कोण initiate करतं? SA node. Where is the SA node located? Let's first make a गोंधळ here and then मी zoom करणार. इथे असतो ना, right? Is there in the just below the superior vena cava. Now, SA node generates the current. SA node is also called as pacemaker of the heart. When the SA node is located in right atrium. When SA node generates the current spreads through atrias. Barabar? Current spreads through atrias. Now let's see, understand it here. Where is the current going? Towards the electrode or away from the electrode? बरोबर. जर इलेक्ट्रोड इकडे असता तर अवे फ्रॉम द इलेक्ट्रोड. हे प्रिन्सिपल सेम आहे. इथेच तुम्हाला सगळे वेव्ह पॅटर्न मिळतील. यू विल गेट ऑल द वेव्ह पॅटर्न हिअर इटसेल्फ. द SA node is your SA node, when SA node fires the signal, electrical impulse spreads through the atrias. In which direction? Right to left. बरोबर ना. Right to left होत आहे तर current is going towards or away? Towards. So this produces a wave which is positive or negative? Positive. And this wave is called as a P wave. Now what is normal P wave? It should be positive in lead 2. पण इलेक्ट्रोड इकडे असेल तर निगेटिव्ह. राईट. हे सगळे प्रिन्सिपल्स आपण इथेच अप्लाय करूया. It should be positive. Now remember, what is P wave? Normal. It should be present. प्रत्येक ECG मध्ये P wave पाहिजेच ना, कारण एट्रिया कॉन्ट्रॅक्ट होतातच आहे. What is normal wave P wave on the x axis and on the y axis? Now remember, P wave normal on the x axis should be 3 millimeter on the x axis, 3 millimeter म्हणजे small box, huh? On the y axis. That means normal P wave is 3 millimeter, and if you see properly, it is smooth upstroke and a smooth downstroke. It should be smooth upstroke and a smooth downstroke. हे सगळ्यांना दिसतंय की मी इथं मी कुठेतरी दुसरीकडे मांडू याला? चला एक सेकंड, मी हे पुन्हा इरेज करतो कारण मागच्यांना दिसणार नाही. Let's say we are looking at the heart here like this, and we have an electrode which is like this, lead 2, and we have seen that the wave is produced by the SA node. It spreads the current through the atrias towards lead 2, and this produces कुठली wave? A P wave. What is P wave normal? It should be present. It is smooth upward and downward deflection, and I can say 3 by 3 small boxes. 3 by 3 small boxes. That means if you see the small boxes, it will be like this. आले? 1, 2, 3 small box and little more than 3. ठीक है? Little more than 3. So this is where we have. So what does P wave shows you about? Atrial activity, or in an electrical way, atrial depolarization. What is depolarization? Is contraction. So depolarization is an electrical event, contraction is a physical event. heart is excitable tissue. It is excited because of electrical current. तर जेव्हा हा करंट स्प्रेड होणार त्यानंतर हार्ट कॉन्ट्रॅक्शन अगोदर होईल की करंट अगोदर जाईल? करंट अगोदर जाणार, नंतर हार्ट फिजिकली कॉन्ट्रॅक्ट होणार. नाउ दिस इज व्हेरी इम्पॉर्टंट टू अंडरस्टँड. So P wave has contracted the heart, or I can say atrias. And what is the physical event? Atrial contraction pushes the blood into ventricles. इथे इलेक्ट्रिकल इम्पल्स स्टॉप झाली ना, बरोबर? नाउ लेट्स से इलेक्ट्रिकल इम्पल्स स्टॉप झाल्यानंतर फिजिकल इव्हेंट त्याच्यानंतर स्टॉप होणार. नाही कळलं? If the heart is stimulated by a current will first get stimulated, then contraction will be there. The current will go, त्यानंतर relaxation चालू होणार. बरोबर? So it takes time, a fraction of second. So when atrias are contracting, what are the ventricles doing? Should be relaxing, because ventricles should receive the blood. Now, if the impulse goes to AV node as early as possible, काय होईल? एट्रिया एम्प्टी होण्याच्या अगोदरच ventricle contract व्हायला लागतील. ते व्हायला पाहिजे की नाही? नको व्हायला पाहिजे. So there is a delay. Now remember, when SA node fires the signal, produces atrial contraction, then the wave reaches to AV node, but AV node spreads the impulse very slowly. Ka? Because this electrical activity must contract the atrias, let the atria be empty, fill up the ventricles, and then ventricles should contract. So there is something you must have heard of, AV nodal delay. Why there is a AV nodal delay? Because we don't want ventricles to contract immediately after the atrial contractions. कारण तसं झालं तर प्रॉब्लेम होणार, एट्रिया प्रॉपर एम्प्टी होऊ शकणार नाही. सो दिस डिले, ते डिले होत असताना करंट प्रोड्यूस होईल का? नाही होणार. देर इज अन आयसोइलेक्ट्रिक लाईन. का? कारण करंट प्रोड्यूस होत, करंट फक्त एव्ही नोड मध्येच आहे, तो डिले करतोय मुद्दाम. इट इज डिलेइंग द करंट. नाउ दिस isoelectric line is called as a PR segment. What does PR segment gives an idea about? AV nodal delay. Is it normal or abnormal? Normal. This is also about 2 to 3 small boxes. Now remember, या सगळ्यांमध्ये abnormality लपलेल्या आहेत. जिथे नॉर्मल गोष्ट आली, हे सगळं मी नॉर्मल गोष्ट इथेच लिहितोय. या सगळ्यांमध्ये abnormal. If the PR interval is prolonged, there is some problem. If P wave is tall, it's some problem. And tall किंवा short कशामुळे? सगळं इथंच आहे. Everything is here. The basic ECG हे लक्षात आल्यानंतर complicated ECGs येतात. पण complicated ECG, in the book everything is mentioned together. So we are not able to understand it properly. If you want to learn Mumbai, for example, let's say ECG is Mumbai. So first you will have to learn that Mumbai is divided into wards. A ward, B ward, C ward, D ward, E ward. And every ward has got sectors. हे कळल्यानंतर तुम्ही गल्ली गल्ल्यांमध्ये घुसा. पुस्तकात काय दिलंय? Wards, गल्ल्या, सगळं together. And because of that, books are not interesting. You will have to know this, and after this, if you read book, it becomes superbly interesting. And if you see any ECG, now you will fall in love with the ECG. एवढं आहे, ते पण आहे, ते पण आहे, and all those things. And believe me, half of the time, things may not be correct, but ठीक है, no problem. Because ECG, I always say, ECG is an entry point. And whenever you go to your native places, if you're a student, relatives will throw their ECGs on you. They show their love. Okay, you are 4th year learning in Mumbai, and you see my ECG, and we don't know, ऐसा, X-ray पण असा, we don't know exactly. But they expect, and they also point out, hey, इथं काहीतरी problem आहे. काय डॉक्टरांनी काय सांगितलं? हा, बरोबर. But if you understand these mechanics, positive कधी मिळणार, negative कधी मिळणार, हे कळलं की सगळे ECGs ओपन होते. And artifacts पण ओपन होतात, म्हणजे abnormality कधी मिळणार आपल्याला. So we are at this part of the cardiac cycle right now. काय होतंय? SA node सिग्नल फायर केली. SA node produces atrial depolarization or atrial activity. What is normal P wave? 3 by 3 small boxes. त्यानंतर काय होतं? Electrical, now physically atrias have contracted, Atrias have pushed the blood into ventricles. Ventricles are getting filled up. तोपर्यंत AV nodal delay होणार. Then when the ventricles are filled up properly, now the impulse goes from AV node to कुठे जाते? Bundle of his. मग ती काय होते? Right branch and the left bundle branch. And then we have Purkinje fibers. म्हणजे टी वेव्ह आल्यानंतर काय येईल? PR सेगमेंट येईल. या दोघांना मिळून म्हणतात त्याला PR इंटरवल. PR इंटरवल वेगळा, PR सेगमेंट वेगळा. PR इंटरवल किती असेल मॅक्सिमम? 3 small boxes and 2 to 3 small boxes. म्हणजे 1 big box आला. 1 big box is how much? आला 1 big box is big. So what is normal PR interval? Less than 0.2. PR interval म्हणजे काय? Beginning of P wave to end of the PR segment. नाही कळलं? PR segment म्हणजे तुकडा. What is segment? तुकडा. PR segment हा PR इंटरवलचा एक तुकडा आहे की ज्याच्यामध्ये अर्धा भाग कोण असतो? P wave. अर्धा भाग कोण असतो? PR segment. This is 3 small boxes. This is 2 small boxes. Becomes 5 small boxes. Becomes 0.2 seconds. So what is normal PR interval? It is 0.2 seconds. Less than 0.2 seconds. आता मी मुद्दाम हा पिरियड थोडा लॉंग करतो जेणेकरून आपल्याला जागा मिळेल पण एवढा लॉंग नसतो तो. इट इज नॉट दॅट मच लॉंग. What are we looking at? We are looking at normal wave pattern in lead 2. नाही कुठे होतो आपण? Where are we right now? We are looking at normal PQRST complex in lead 2. आणि हे नॉर्मल कसे असतात कसे दिसतात ते आपण बघतोय. We have understood that P wave is smooth upstroke, smooth downstroke, 3/3 small box. PR segment is 2 small box, is an isoelectric line. Why isoelectric line? Because there is an AV nodal delay. There is no current that is being produced and appreciated by the electrode. त्याच्यानंतर काय होतं? Bundle of his and right and left bundle branch सुरुवात होते. Now लक्षात घ्या सगळ्यात पहिले depolarize कोण होईल? Interventricular septum. Then we'll go to left side and right side. Now understand काय होतं? In the bundle of his we have कुठलं चेंबर जास्ती प्रॉमिनंट असतं? जास्त करंट घेतं का? Because left wall is thicker than the right wall. So current is more in the left side than the right side. So interventricular septum जर बघितला हा राईट साइडचा आहे हा लेफ्ट साइडचा आहे. करंट कुठे जास्ती आहे? मग करंट मोठ्या करंट कडनं कमी करंट कडे जाणार ना. करंट विल ऑलवेज फ्लो फ्रॉम हायर व्होल्टेज टू लोअर व्होल्टेज. सो इंटरव्हेंट्रिक्युलर सेप्टम मध्ये करंट असा फ्लो होणार बरोबर अवे फ्रॉम द लीड पण किती एकदम शॉर्ट पिरियड साठी बरोबर. सो दिस प्रोड्युसेस व्हॉट पॉझिटिव्ह की निगेटिव्ह? अ क्यू वेव. See everything has got a reason and that reason is in the same principle. There is a Q wave. Why Q wave is negative? Because interventricular septum depolarizes from left side to why left to right? Because more current is on the left, less current is there on the right. मैं आ रहा हूँ वापस. Yes. AV node तक पहुंच गई तो AV nodal delay is this. Then the first thing to depolarize is interventricular septum. Interventricular septum for example ये है, ये लेफ्ट साइड का है, ये राइट साइड का है. बड़ा उंगली किधर है? लेफ्ट साइड. दैट मीन्स लेफ्ट वेंट्रिकल हैज गॉट मोर करंट देन द राइट वेंट्रिकल. सो ये दोनों ये वेंट्रिकुलर सेप्टम में ज्यादा करंट से कम करंट की तरफ करंट फ्लो करेगा ना. सो करंट विल फ्लो अवे फ्रॉम. सो दिस अ क्यू वेव. दिस अ नेगेटिव बट फॉर अ वेरी शॉर्ट ड्यूरेशन. का? कारण इंटरव्हेंट्रिकुलर सेप्टम में लगेच कोण सुरुवात होते? राइट एंड लेफ्ट. Now this wave now will divide into 2. बरोबर ना. एक वेव इथे जाणार, एक वेव now the wave will go to right bundle branch and left bundle branch. आता कसं कॉम्प्लेक्स मिळेल आपल्याला? पॉझिटिव्ह की निगेटिव्ह? पॉझिटिव्ह भी मिलेगा, निगेटिव्ह भी मिलेगा, राइट. एंड Compared to the atrial current, this current will be higher or lower? Because ventricular mass is much more. Current is proportional to mass. Let's say current is proportional to muscle mass. पुढचं प्रिन्सिपल आपल्याला मिळालं. Current is proportional to mass. And remember, we want this electrical current to spread very rapidly through ventricles. Current काय होईल? It should contract more vigorously. So if you see the pattern, one wave will be positive, the other wave will be. So this is what is called as an R wave and S wave. Why it divides into positive and negative? Because one current goes towards, other current goes away. Kutla current goes towards left side. Kutla current goes away. If you apply this, and it is also for very short duration. Current moves very fast, and then the physical activity of the heart will start. The slowly spread झाला तर काय होईल? Ventricle will contract slowly like this. We want ventricle to contract all because it tend to project the blood all over body. So the duration is very less. And if you also see properly, कुठली wave जास्त असेल, R wave की S wave? If you also see properly, R wave is taller than the S. का? Because muscle mass on the left side is more than the right side. So R wave कोणाची आहे? लेफ्ट साइडची आहे की राइट साइडची आहे? लेफ्ट वेंट्रिकलची आहे. एस वेव्ह कोणाची आहे? राइट साइड. जर हा लीड इकडे बघत असता तर आर शॉर्ट असती, एस डीप असता. तेव्हा आर कोणाचा होता? राईटचा. एस कोणाचा असता? मी कॉम्प्लिकेट करत नाही, हे अजून पुढे अजून उलगडणार. दिस थिंग विल ओपन अप इन द नेक्स्ट कॉमन सेन्स. So what is normal QRS complex? Now, normal QRS complex, it should finish in 0.1 seconds. It's on. It should finish in 0.1 seconds. 0.1 second मध्ये finish व्हायला पाहिजे. That means किती small boxes किंवा किती big box? 2 to 3 small boxes or half big box. It should be half big box. म्हणजे on the x axis I'm talking about. X axis I'm talking about. ये PR segment ये वाला AV nodal delay वाला है. हाँ, that she's right. Now why we say PR segment? Why not PQ segment? पहले स्टेशन तो कुर्ला आएगा ना, बाद में सायन, माटुंगा एंड अदर. So ये PQ segment क्यों नहीं बोलते? क्यों नहीं बोलते? Because lot of times Q wave is not seen. इतना शॉर्ट रहता है कि नहीं दिखता है. राइट? लॉट ऑफ टाइम Q wave is absent. क्योंकि अगर फॉर एग्जांपल पेशेंट ओबीज है, मोटा है, तो क्या मिलेगा? All waves will be short, right? क्यों? Remember, everything is related to current and electricity. The patient is obese. Electrodes are away from the heart. So deflection कम मिलेगा, तो इतना छोटा कभी कभी दिखेगा भी नहीं. So we don't say PQ segment, we say PR segment. Because if Q wave is absent, we don't have any problem. But if R wave is absent, then big problem. That means left ventricle not contracting at all. So R wave has to be there. So because of that, they say PR segment. Because R wave is always present. If R wave is not there, don't read ACG. Okay, remove your cap and then say, I'm sorry, for example. Because if R wave is absent, patient is dead. Patient is already dead. You must have seen that movies and that straight line comes up. And then if the hero is going to come up, बाहेरून कोणती ओरडलं की तू नाही जाऊ शकत, तुला की. So this is what is, and what is now QRS complex. X-axis normal QRS complex किती असतो? 0.1 seconds. What is the normal criteria of QRS complex on y-axis? What is the normal criteria of QRS complex on y-axis? First thing is, if you're looking at lead 2, R should be bigger than S. If it is ulta, then there is a problem. Let's say, for example, looking at lead 2, in which R is smaller than S, what is your interpretation? Either left ventricle is not taking the current properly or right ventricle is taking more current. म्हणजेच काहीतरी गडबड असणार. बरोबर? But in lead 2, R wave should be bigger than S. Second important point is R should be around 4 to 5 big boxes and S should be around 3 to 4 big boxes. पण हे हा क्रायटेरिया ventricular hypertropicity वेगळा आहे. पण we are looking at lead 2. So R wave is around 4 to 5 big box. S wave is around 3 to 4 big box. 3 to 4 big box. So this is where the ventricular activity, ventricular current, किती वेळेसाठी असतो तो? 0.1. But if you see properly, ventricular systole lasts for how much time? If you see calculations in the cardiac cycle, remember 0.1, 0.7, 0.3, 0.5. Ventricular contraction lasts for 0.3 seconds. But electrical activity lasts for only. Electrical activity is followed by physical activity. And the electrical activity will be finished in 0.1 and then 0.3 physical activity will be there. So current has started from SA node, spread through the atrias, gone to the AV node. AV node generates its own current or follows the SA nodal current? Follows the SA node because we want only one conductor for this bus. If there are two conductors and two drivers, it's going to make a problem. Even if both the can you see any bus driven by two drivers together? Even if both are expert, what will happen? They'll come with an accident, right? But we want only one pacemaker of the heart, and that is SA node. Doesn't mean that SA node का signal अगर AV node तक नहीं आ रहा है, तो patient कुछ नहीं करेगा. Then AV node generates its own rhythm. लेकिन as far as possible, pacemaker of the heart is SA node. क्योंकि SA node का firing capacity ज़्यादा है, rate I am talking about, AV node का कम है. So SA node gives every electrical excitable tissue current of themselves so that everything is followed. Everything follows the SA nodal rhythm. You must have heard about SA nodal rhythm, it is called as SA nodal rhythm. आता याच्या पुढे काय होईल? Atrias have contracted in this period, ventricles have contracted in this period. आता काय होईल? Now what is the next? Ventricular relaxation. Is there any current flowing? This is a long isolated line called as an ST segment. There is an ST segment. Now how long it should be? How long it should be? There is no criteria because this depends on the heart rate. Heart rate जितना ज़्यादा उतना ST segment छोटा. Heart rate जितना कम उतना ST segment बड़ा. So ST segment only criteria is it should be isoelectric. There should not be any upward deflection or a downward deflection. It should be isoelectric. It should be isoelectric. Now then what happens? Here what are the ventricles doing? Relaxing. What are the atrias doing? Also relaxing. हाँ? पुन्हा contract करतील atrias? मग PV पुन्हा मिळायला पाहिजे ना आपल्याला. Right? Now remember, your atrias are contracting and ventricles relaxing. Your ventricles are contracting, atria starts relaxing. Atria already relaxed, na? Atrial contract. Let's say, for example, physiology. If the cardiac cycle takes 0.8 seconds, atrial events and ventricular events. Atrial activity में क्या होता है? 0.1 is atrial contraction, 0.7 is atrial, 0.3 is ventricular contraction, 0.5 is. So if you see properly, atrias only contract for 0.1 second. For the whole cardiac cycle, atrias relax. तो यहाँ पे भी क्या करेगा atria? Relax करेगा. Ventricles contract only 0.3 seconds. That is activity here. but for 0.5 seconds, no electrical activity. No, ventricles are relaxing. Ventricles are relaxing. Now, just before the next event in the cardiac cycle, the myocardial muscle fibers undergo something called as a hyperpolarization. Now, remember there is depolarization, repolarization. Repolarization makes the electrical potential come to resting membrane potential, but the electrical potential goes even more negative in cardiac cycle. There is something called hyperpolarization, in which electrical activity is not there, but the muscle fibers become more stimulated because of hyperstimulation or hyperpolarization, and that is what is seen by a again positive wave called a T wave. T wave not that important to understand basic problems, but T wave is because of hyperpolarization. Hyperpolarization. This is because of potassium channels. If you remember physiology, depolarization is because of opening sodium channels. Barabar na? Repolarization because of opening potassium channels. So sodium moves out, sodium moves in, all those complicated things. But this is because of, so all potassium problems will be seen in T wave. You know, I've got hyperkalemia, tall T waves, short T. All is seen in the T wave. All is seen in the T wave. हाँ. हो. जेव्हा पण करंट मूव्ह होतो कुठल्या टिश्यू मध्ये, that is because of sodium moves into the cells. Sodium is more outside than inside. Potassium is more inside than outside. Sodium is a positive ion. Resting membrane potential असतं -70 millivolts. Positive ions आले, the electrical potential goes positive. That is what is called a depolarization. एकदा depolarization झालं, एकदा ions equal झाले की त्याला बॅलन्स करायला पोटॅशियम चॅनल्स ओपन होतात. पोटॅशियम बाहेर निघतो कारण पोटॅशियम इज मोर इनसाइड दॅन आउटसाइड. दॅट इज व्हॉट पोटॅशियम इज ऑल्सो पॉझिटिव्ह आयन. पॉझिटिव्ह आयन्स मुव्हिंग आउट म्हणजे ते निगेटिव्ह होईल पुन्हा. म्हणजे डिपोलरायझेशन इज इलेक्ट्रिकल एक्सायटेशन. डिपोलरायझेशन इज कमिंग बॅक टू नॉर्मल. आता हे सोडियम पोटॅशियम जे आत बाहेर केले त्यांना पुन्हा आत बाहेर करावं लागेल. तिथे सोडियम पोटॅशियम पंप कामात होतो. हे थोडं म्हणजे सोडियम इज मोर आउटसाइड, पोटॅशियम इज मोर इनसाइड. हे कोण मेंटेन करतो? सोडियम पोटॅशियम पंप. सोडियम पोटॅशियम पंप. हे सगळं झाल्यानंतर सोडियम पोटॅशियम पंप पुन्हा ते इक्वल करतो आणि नंतर पुन्हा टिश्यूज बिकम एक्साइटेबल वन्स अगेन. थोडं फिजिओलॉजी आहे. फर्स्ट इयर फिजिओलॉजी आपण आठवते, नवं मेडिकल सीट मिळालं होतं. वी आर ऑन इन द एअर अँड सेम्बोलिंगम करून घेऊ नंतर फॉर एक्झाम्पल. परंतु हे सगळं ऑफकोर्स मी पण शिकवायला चालू केलं, त्यानंतर पुन्हा वाचायला चालू केलं. देन वी हॅव अंडरस्टूड की काय प्रॉब्लेम आहे. परंतु हे सगळं बेस्ड ऑन फिजिओलॉजी. हे सगळं काय, मी फिजिओलॉजी घेतोय की ईसीजी घेतोय? हे फिजिओलॉजीच आहे. मी ॲबनॉर्मॅलिटी अजून सुरू केलेलीच नाही, पण ॲबनॉर्मॅलिटी सगळी इथंच आहे, याच्यातच आहे. याच्यातच ॲबनॉर्मॅलिटी. करंटली वी आर लर्निंग लीड 2. बरोबर ना? हे चालू आहे. ऑक्सिजनवर आहे, गॅस्पिंगवर आहे, चालू आहे ना? बिकॉज लॉट ऑफ पीपल वॉन्टेड दॅट. पाठवूया त्यांना आपण. लेट्स समराइज व्हॉट इज नॉर्मल पी वेव्ह. पी वेव्ह शुड बी, वी आर लुकिंग ॲट लीड 2 ओनली राईट नाव. दुसरं लीड कधी बघूया, मी सांगेन तेव्हा. आतापर्यंत काय आपण बघतोय लीड 2. सो व्हॉट इज पी नॉर्मल पी वेव्ह should be present. Smooth upstroke, smooth downstroke. 3/3 small boxes. Atrial activity produces atrial depolarization. Then we have PR segment, isoelectric, again 2 small box. PR interval is 5 small boxes or 1 big box. Ultimately, PR interval का त्याने वेगळा काढलाय? कारण PR interval is the atrial events. ज्याच्या पुढे काय सगळे ventricular events. म्हणून त्यांनी PR interval वेगळा केला. PR interval is the, indirectly बघायला गेलो, PR interval is a time between AC nodal activity and AV nodal activity. बरोबर? Then we have a Q wave, small Q wave. Then we have QRS complex. QRS complex is much taller than P wave. का? Because the current is much more compared to the ATS. ATS से wall thickness किती असते? 0.1 millimeter, 0.1 centimeter only. 1 millimeter. Ventricle ची thickness 7 to 8 millimeters. And right ventricle is 4 to 5. त्यामुळे थिकनेस जेवढी जास्त तेवढं काय करंट असतं. म्हणून क्युआरएस फॉर्म्युला आपल्याला असं मिळालं. Then we have ST segment, then we have T wave. लक्षात आलं? आता या नॉर्मल पॅटर्न कडनं आपण एबनॉर्मल कडे जाऊया. वेव्ह बाय वेव्ह. पी वेव्हचे एबनॉर्मलिटीज, पी आर इंटरवलचे एबनॉर्मलिटीज, क्यूआरएस कॉम्प्लेक्सचे एबनॉर्मलिटीज, एसटी सेगमेंटचे एबनॉर्मलिटीज आणि टी वेव्हचे एबनॉर्मलिटीज. दॅट इज व्हॉट विल कम्प्लीट द बेसिक पार्ट. एस वेव्ह, कारण लीड कुठे आहे? लेफ्ट साइडला. एक करंट कुठे जातोय? राईट वेंट्रिकल कडे. एक करंट कुठे जातोय? लेफ्ट वेंट्रिकल. तर मग लेफ्ट वेंट्रिकल कडे जाणारा करंट आर गोइंग टुवर्ड, राईट? दिस इज आर वेव्ह. राईट वेंट्रिकल कडे जाणारा करंट इज अवे, so this is negative. See, current is dividing into two. One is going in right direction, other is going in. So one is going towards the electrode, one is going away from the electrode. Right? So that is what is the reason we get QRS complex. जाऊया पुढे. हां. एक्स सेगमेंटची लेंथ तुमच्या हार्ट रेटवर आहे. कारण हार्ट रेट हे एवढं फिक्स आहे, पीआर इंटरवल फिक्स आहे, क्यूआरएस कॉम्प्लेक्स फिक्स आहे. हार्ट रेट नुसार कोण व्हॅरी करणार? ते एसटी सेगमेंट. नाही कळलं? हार्ट रेट समजा 60 आहे, त्यामुळे हेच कार्डियक सायकल थोडं लांब होतील ना. पण लांब कुठल्या लेवलला होतील? इथे नाही होणार, इथे लांब होतील. कारण टाइम रिक्वायर्ड फॉर दी करंट टू ट्रॅव्हल फ्रॉम एसए नोड टू एव्ही नोड इज फिक्स्ड 0.2 सेकंड्स ओनली. त्याच्यापेक्षा जास्त होणार नाही. त्यामुळे हार्ट रेट नुसार कोण लांब किंवा शॉर्ट होईल? तर एसटी सेगमेंट आणि टी वेव्ह. लक्षात आलं? जाऊया पुढे. नाव मी तुम्हाला ऑप्शन देतो, तुम्ही मला सांगा काय होत असेल हार्टमध्ये. लुकिंग ॲट दिस, करंट कमिंग टुवर्ड्स पॉझिटिव्ह, गोइंग अवे, अमाऊंट ऑफ डिफ्लेक्शन, बिग बॉक्स, स्मॉल बॉक्स आणि मसल मास. याच्यावर सगळं डिपेंड आहे. हे सगळे मसाले आहेत आणि याच मसाल्यांवर आपण सगळं बनवू शकतो. एव्हरीथिंग कॅन बी मेड ऑन दोज 6 मसालाज. तर जाऊया पुढे. लेट्स से फॉर एक्झाम्पल द फर्स्ट, हे मी एवढाच बोर्ड वापरणार आहे because these things are important to be kept on the board. P wave abnormalities. Let's say for example we have absent P wave. P wave nahi hai. SA node is not generating the current. Now remember, absent. Now how will the ECG look like? This is D wave, QRS complex. A normal ECG, P wave is absent. When you see properly, if the P wave is absent, the baseline is like this. Now remember, there is a condition, very common, comparatively common. The P wave is absent, but the QRS complex is coming at the regular intervals. Now this condition in which, now what is the interpretation says? SA node is not firing a signal. But if QRS complex is coming regularly, म्हणजेच current is reaching to the AB node. याचा अर्थ असा असतो आणि wave baseline is VV. Now this condition is called as an atrial fibrillation. Is called as an atrial fibrillation, in which atrias are not contracting, but atrias are just a very common condition because of maybe valvular problems or atrial dilatations. Because of valvular problems or atrial dilatations. Atrial fibrillation. Will the patient be alive or dead? कारण ventricle contract. But ventricle contract होऊन पण atrial contraction fills up the ventricles, right? So atrias are not contracting, the ventricles will not get filled up. So ventricle is not getting filled up. What is the point in ventricular contraction then? कसं काय? ग्रॅव्हिटी मुळे म्हणजे पेशंटने शीर्षासन केलं तर डेड. Thinking on a right track. Now remember, in the ventricular diastole, ventricle gets filled up. Ventricle diastole for किती मिनिटासाठी असतो? 0.5 seconds. 0.5 seconds, बरोबर ना? त्या 0.5 seconds मध्ये ventricle fill up होतोय ना, त्याच्यामध्ये atrial contraction किती असतो? Only 0.1. व्हॉट डज दॅट मीन? वेंट्रिकलचा फिल होण्यामध्ये एट्रियल कॉन्ट्रॅक्शनचा रोल फक्त 0.1 सेकंड पुरताच आहे. बाकीचं 0.4 सेकंड ventricles are filled up because of the suction effect. लक्षात येते? त्यामुळे जरी एट्रिया कॉन्ट्रॅक्ट नाही केला तरी प्रॉब्लेम एवढा नाही, कारण 80% तर वेंट्रिकल फिल होत आहे. कारण कशामुळे? ventricle muscles are dilating also actively, producing a negative pressure that sucks in the blood. म्हणून एवढा पण या पेशंटला काय करावं लागेल? काहीतरी करता येईल आपल्याला? व्हॉट इज दिस पेशंट ऑन हाय रिस्क ऑफ? एट्रिया कॉन्ट्रॅक्ट होत नाहीये तरी पण वेंट्रिकल तर 80% भरतायत, राईट? पण एट्रिया कॉन्ट्रॅक्ट होत नाही तर एट्रियामध्ये ब्लड स्टॅग्नंट होणार. ब्लड स्टॅग्नंट झालं तर काय? ब्लड क्लॉट होणार. हेच ब्लड क्लॉट झालं तर हे क्लॉट सगळ्यात पसरतील ना. So this patient doesn't require emergency treatment but requires an anticoagulant, aspirin on a longer time. त्याला 2D echo करायचा, त्याच्यामध्ये कळेल की बाबा क्लॉट आहेत की नाही आहेत. क्लॉट नसतील तर प्रोफायलॅक्टिकली अँटीप्लेटलेट किंवा अँटीकोॲग्युलंट चालू करावे लागतील. What is this patient complain you about? काय complain करेन हा patient? Will this patient come with some complaints? Palpitation, right? का? Everything has got an answer. Ventricle पूर्ण भरतायत की अर्धेच भरतायत? कमीच भरतायत ना. म्हणजे स्ट्रोक व्हॉल्यूम काय असेल? कमी. स्ट्रोक व्हॉल्यूम कमी असेल, हार्ट रेट काय असेल? जास्त. म्हणून पेशंट विल कंप्लेन अबाउट पॅल्पिटेशन. पेशंट विल ऑलवेज से जरा आम्ही काम करायला लागतो छातीत धड 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 होतं. ईसीजी थोडंफार काहीतरी सांगू शकतो. Let's say P wave is absent, patient complains about palpitation. Think about an atrial fibrillation. Atrial fibrillation. लक्षात आलं? हे पण लीड टू मध्ये बघतो. अजून एक पुस्तक तुम्हाला कुठलंच लीड सांगत नाही, मी जेव्हा सांगेन तेव्हा. हे सगळं लीड टू मध्येच आहे. व्हॉट वॉज द फर्स्ट पॉसिबिलिटी? Absent P wave. Second possibility, too many P waves. Too many P waves. That means how will the ECG look like? आता if you see properly, these are not actual P waves, कारण हे 3x3 स्मॉल बॉक्स नाही आहेत, परंतु हीच विविंग बेसलाईन जी आहे ही जरा जास्त दिसतीये. बरोबर? हे बघाल ते मे बी 1 small box or 2 small boxes maximum, not proper 3 small box. Remember, this is also the similar condition. आता if you see theoretically, this vibration speed is about 300 to 400 per second. ह्याला म्हणतात atrial flutter. आता remember, let's say these are the atrias. Contraction for 0.1, relaxation for 0.7. Contraction for 0.1. This is what is normal. In atrial fibrillation काय होते? At the rate of, म्हणून तर एवढं अप्रिशिएट होत नाही, फक्त विविंग बेसलाईन दिसते. आता काय होते? हे फ्लटर आहे. हे पण सिमिलर सिच्युएशन आहे, फक्त एवढं की थोडी ऍक्टिव्हिटी आहे, म्हणजे या वेव्ह थोड्या दिसतील आपल्याला. This is called an atrial flutter. Similar condition. याच्यामध्ये कोॲग्युलेशनची रिस्क जास्त आहे की कमी आहे? कमी आहे. ऍटलीस्ट थोडंफार एट्रिया कॉन्टॅक्ट होतं. नाउ समवन विल अराउज एन डाऊट हिअर की एवढे सगळे पी वेव्स आहेत, एवढे सगळे क्यूआरएस कॉम्प्लेक्स का नाही आहेत? कारण पी वेव्ह शुड बी फॉलोड बाय क्यूआरएस कॉम्प्लेक्स. नोडल डिले है. That is what is a protection given to us. जर वेंट्रिकल पण याच स्पीडने कॉन्ट्रॅक्ट झालं तर काय होईल? वेंट्रिकलला टाइमच मिळणार नाही भरायला. पेशंट विल डाय. सो दॅट इज द रिझन एव्ही नोडल डिले इज मोस्ट इम्पॉर्टंट. एव्ही नोडचं दार जे हे सगळ्यांना अलाउ करत नाही, दर 5 सेकंदामध्येच उघडतं. हॅव यू हर्ड अबाउट रिफ्रॅक्टरी पिरियड? This is what is AV nodal refractory period is highest in the heart. AV node will not allow all the impulses to be carried forward. Refractory period मध्ये काय असतो? त्या पिरियड मध्ये वेंट्रिकल किंवा एक्साइटेबल टिश्यू करंट पास करणार नाही. That is the reason we have so many P waves like patterns, but only few QRS complexes. Only few. That is what is because of AB nodal delay. Now, what is this patient requires to be done? Again, an anticoagulant. समजा atrial because of atrial dilatation. Atrial dilatation कशामुळे होणार? Let's say this patient has got mitral stenosis. त्यामुळे एट्रिया डायलेट झाले आणि डायलेट झाल्यामुळे फिब्रिलेशन मध्ये गेले. तर 2D इको केल्यानंतर आपल्याला क्लॉट दिसणार. 2D इको केल्यानंतर आपल्याला वॉलची सिच्युएशन पण दिसणार. जर वॉल मध्ये स्टेनोसिस असेल तर सब्जेक्ट द पेशंट फॉर सर्जरी, वॉल सर्जरी. हा वॉल ओपन केला, एट्रियल डायलेटेशन कमी होणार, पुन्हा पीव्हीएम नॉर्मल येऊ शकते. नाही कळलं? ईसीजी मध्ये हा प्रॉब्लेम आल्यानंतर नेक्स्ट स्टेप इज व्हॉट? सब्जेक्ट द पेशंट फॉर 2D इको. 2D इको का? कारण कळेल की क्लॉट वगैरे तर नाहीये. जर हा क्लॉट लेफ्ट साइड मध्ये आहे तर काय होईल? लेट्स से देयर आर 3 clots of 3 by 3 centimeter size. Patient is sitting on a bomb. कारण हाच क्लॉट तर लेफ्ट वेंट्रिकल मध्ये गेला आणि त्याने पुश केला कॅरोटिड आर्टरी मध्ये. Patient will have stroke, hemiplegia. If you diagnose this, you have saved the patients. हाच क्लॉट समजा गेला किडनी मध्ये, मग काय होईल? One kidney will go. हाच क्लॉट गेला पायामध्ये, patient will have gangrene. So we can save the patient looking at an ECG. बरेचसे पेशंट नॉर्मल पण आहेत, बरेचसे पेशंटना क्लॉट नसेल पण ऍटलीस्ट वी कॅन कम टू नो की काहीतरी प्रॉब्लेम असू शकतो. 2 प्रॉब्लेम कळले पीवेवचे. कुठले कुठले? Absent P waves and too many P waves. This is what is called as a sawtooth pattern. Sawtooth appearance. ते लाकूड कापतात त्याचा सॉ कसा असतो? Sawtooth appearance. कारण this looks like some teeth are non-sharp, some teeth are sharp, like this. जाऊया पुढे. अजून थोडे प्रॉब्लेम्स आहेत पीव्हीएम मध्ये. नंतर हवं तर आपण एक ब्रेक घेऊया. नको. Okay. Let's go to the other problems. Now let me make you understand. If it is a tall P wave, now how will you interpret this as? Let's say this is what is a P wave, QRS complex, and T wave. We have a P wave which is tall, more than 3 small box. आता कसं करणार? काय बघणार? काय असेल? That means SA node करंट जास्त प्रोड्यूस करतोय. SA नोडचा करंट तेवढाच असतो. करंट कमी किंवा जास्त इज बिकॉज ऑफ व्हॉट? इथं होतं मी मसल मास. Current is proportional to muscle mass. That means what? Let's say if the P wave is taller, atrial hypertrophy. Now remember, hypertrophy म्हणजे काय? More number of muscle fibers. Atrias मध्ये एवढी पॉवर नाहीये की ते हायपोट्रॉफी करेल, कारण ऑलरेडी व्हेरी फ्यू मसल फायबर्स. So this is an atrial dilatation or hypertrophy also. ठीक है. So we see the P wave and we come to know that if it is tall, more than 3 small boxes. Tall म्हणजे कुठे? Y-axis, 3 small boxes. It may be atrial dilatation or hypertrophy. Now dilatation and hypertrophy कशामध्ये कळेल? 2D echo मध्ये. We subject patient for 2D echo काढूया. Can you say if it is right atria or the left atria? Now this is post graduation in P wave tall. What is graduation in P wave tall? Tall P wave is atrial dilatation or atrial hypertrophy. Can you come to know right side ki left side? Always right. Left atria can also dilate. If it is a mitral stenosis, which atria will dilate? Left atria. If it is a tricuspid stenosis. But how to come to how do you understand? Can you understand by looking at the P wave? This P wave because of right atria ki left atria? बेचारा लेफ्ट एट्रिया का वेव ही नहीं है. It is both because both atrias are contracting, right? So this P wave is because of both the atrias. But कौन सा एट्रिया पहले कॉन्ट्रैक्ट होगा और बाद में दूसरा कॉन्ट्रैक्ट होगा? Is it possible that one atria contracts little earlier than the left? I've already given the answer. ऐसे नोड किधर है? So current will be received by right atria first and left atria later. So if you divide this P wave has this P pattern for right atria and this pattern for left atria. Why? Because SA node is on the right side. So we come to know about right atrial dilatation or left atrial dilatation looking at which part of the P wave is taller. If we have a red part tall and then we have normal, this is what? If we have, so if it is like this, it is, if it is like this, which one is common? Which is the most common valvular problem? So mitral stenosis अगर होगा तो कौन सा dilate होगा? So this looks like M, right? This is called a P mitral A. This is because of mitral stenosis. Because of mitral stenosis. So let's say a patient comes to you with a history of mitral stenosis operated. How will you come to know by looking at ECG that the operation was successful? पहले P mitral रहेगा, बाद में P normal हो जाएगा. So this is what there are two types of tall P waves. Atrial dilatation and left atrial dilatation. Right atrial dilatation will be first half of the P wave will be taller than the other, and left atrial dilatation second half will be taller. Commonest cause of this is pulmonary stenosis, PS. This is MS. So this is called as P pulmonale, and this one is called as P mitrale. P mitrale. Things are clear till now? So there are four abnormalities in the P wave. Absent P wave, too many P waves, right atrial dilatation and left atrial dilatation. Left atrial dilatation. What is the next one is a PR segment. We have PR segment or PR interval. Let's say PR interval. What is the normal PR interval? काय म्हटलं होतं? 0.2 seconds. हा जिवंत आहे? गेला? एवढं घेऊन मी मोबाईल चेंज करतो. आपण ब्रेक नाही देणार, but I'll change because there are a lot of people are asking for this. कारण हे एकदा कळलं, the whole ECG becomes interesting. Next one काय होता? PR interval. किती होता PR interval? Normal PR interval is 0.2 seconds. It should be maximum 0.2. It can be less than 0.2 normal, but it should not be more than 0.2. Now remember, what is this PR interval giving an idea about? Beginning of the P wave to beginning of QRS complex. म्हणजे beginning of atrial contraction to beginning of ventricular contraction. म्हणजे this is giving an idea about conduction of the impulse from atrial. किती वेळ लागतो ते पोहोचायला? 0.2 seconds. It may reach in less time, normal, but it should not be more than 0.2. If it is more than 0.2, it is called as, what is it called as? AV nodal block. Have you heard about first degree heart block, second degree heart block and third degree heart block? म्हणजे AV nodal block म्हणजे काय? Atrioventricular nodal block or AV nodal block. That means AV node कधी impulse येत नाही वेळेवर. किती वेळेत यायला पाहिजे ती? 0.2 seconds. 0.2 seconds. Now, to understand the heart block, this is what is called an atrioventricular blocks. That means there is a block. Block म्हणजे काय? Conduction व्हायला block होत आहे. So there is a block between current traveling from SA node to AV node. Now to understand this, what is, let's say SA node is Dadar and AV node is Bandra. Let's understand it by this analogy. SA node is Dadar and AV node is Bandra or Kurla if you are saying on the central line. So how much time does it require for a vehicle to travel from SA node to AV node? That means let's say if you're traveling by road, you take 0.2 seconds maximum to travel from Dadar to Bandra. This is normal. You may travel faster if the traffic is not there. But traffic लवकर पोहोचलं तर काय प्रॉब्लेम नाही ना, उशिरा पोहोचलं तर प्रॉब्लेम आहे, राईट? So maximum travel time is 0.2 seconds. If it is taking more time, let's say there is a little traffic jam, थोड़ा सा traffic jam है, काय होईल? Vehicle will take more time for traveling from Dadar to Bandra. That means more than 0.2 seconds. This is what is called first degree heart block. Is more than 0.2 seconds. कौन सा? PR interval. Also draw the ECG. कारण पुढे complicate होत जाईल. Let's see, this is what the P wave, QRS complex, and T wave. This is what is normal. And first degree heart block looks like this. कुठे वाढलंय? एवढं डिस्टन्स वाढलंय. पण थोडी ट्रॅफिक जॅम असेल तर all vehicles which are leaving Dadar will reach Bandra. म्हणजे काय? Then understand. What is vehicle leaving from Dadar is P wave. If the impulse reach to the AV node, ती पुढे जाईल ना? बरोबर की नाही? ते पुढे जाईल तर कुठली वेव प्रोड्यूस होईल? QRS complex. So what is first degree heart block? Is there is a little traffic jam between Dadar and Bandra, but all vehicles which are leaving Dadar are reaching Bandra. That means all P wave followed by. आता हे कुठे कळेल आपल्याला? पुन्हा लीड टू मध्येच खाली मोठा लीड टू असतो त्याच्यामध्ये कळेल आपल्याला. म्हणजे व्हॉट इज फर्स्ट डिग्री हार्ट ब्लॉक? इट इज प्रोलॉंग PR इंटरवल. It's a prolonged PR interval. There are a lot of reasons for this. It can be valvular problem, it can be myocardial infarction, it can be genetic, it can be congenital also. So first degree heart block doesn't produce much problems. इथे काय झालं? There is a little traffic jam. Now you all understand that when the traffic jam increases, what will happen? More than 0.2, अजून more than 0.2. बट काही जण काय करतील विचार, जाऊ दे नंतर जातो. काही इम्पल्सेस जे आहेत ते रीच होणारच नाही तिथपर्यंत, कारण तोपर्यंत त्या व्हॅनिश होतील. दॅट मीन्स some vehicles which if the traffic jam increases, some vehicles may not reach to Bandra. Some vehicle will come back from Matunga again to Dadar. जाऊ दे नंतर जाऊ. This is of course impulse doesn't follow like this, but we can understand like this. काही impulses will reach to Bandra, काही impulses will not reach to Bandra. So let's say for example, second degree heart block says some P waves will not be followed by QRS plus. Some P waves. Let's say for example, how will the ECG look like? Where should I draw? हे दिसते सगळ्यांना इथे? I'll draw it here. Second degree heart block. This is what is the normal PQRST complex. अजून मला छोटा करायला पाहिजे. Now which one is a P wave and which one is a T wave? कसं कळेल आपल्याला? छोटी is P wave, मोठी is T wave. So this is what is normal. P wave, QRS complex. P wave, QRS complex. P wave, QRS complex. फर्स्ट डिग्री हार्ट ब्लॉक मध्ये काय झालं, हे मोठं झालं फक्त, बट ऑल पी वेव्स फॉलोड बाय क्यूआरएस कॉम्प्लेक्स. सेकंड डिग्री हार्ट ब्लॉक मध्ये काय झालं, सम पी वेव्स विल नॉट बी फॉलोड बाय क्यूआरएस कॉम्प्लेक्स. इथली पुढची पी वेव विल नॉट बी फॉलोड बाय क्यूआरएस कॉम्प्लेक्स. म्हणजे इफ यू सी प्रॉपर्ली, let's say there is some, have you heard about 3:1, 4:1, 2:1? That means two P waves followed by QRS complex, one not followed by. That is what is called 2:1 pattern. 3:1. हे बघा, हे आपल्याला सगळं लॉंग लीड टू मध्ये दिसणार खाली. So some P waves will not be followed by QRS complex. ही P wave होती, QRS complex नव्हता. पुन्हा, now remember, is the AV node producing own rhythm at this point? काही वेव्ह तर मिळतात ना त्याला, तर एव्ही नोड म्हणतो चल ठीक आहे, मी एसी नोडला फॉलो करतो. त्यामुळे क्यूआरएस कॉम्प्लेक्स विल बी आफ्टर द पी वेव्ह ओनली. तो पुढची वेव्ह यायचा वेट करेल. दॅट इज व्हॉट इज पी वेव्ह नॉट फॉलोड बाय, सम पी वेव्स नॉट फॉलोड बाय क्यूआरएस कॉम्प्लेक्स. तर ईसीजी विल लुक लाईक दिस. दोन नॉर्मल वेव्ह पॅटर्न, एक पी वेव्ह, नो क्यूआरएस कॉम्प्लेक्स. पुन्हा पुढची पी वेव्ह, पुन्हा पुढची पी वेव्ह. Can you also diagnose this looking at the pulse? Only bradycardia, but a regular heart rate? Regularly, irregular. Now remember, जिथं क्यूआरएस कॉम्प्लेक्स आला, पल्स कुठे लागेल तुम्हाला, क्यूआरएस कॉम्प्लेक्सला का पी वेव्हला? वेंट्रिकल कॉन्टॅक्ट झालं तरच पल्स लागेल ना. The patient has got 2:1. That means the heart rate pulse will be tuck tuck gap, tuck tuck gap, tuck tuck gap. Or 3:1 असेल तर tuck 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 gap, tuck 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 gap, tuck tuck. So what is this? Regularly irregular rhythm. Looking at the pulse, we can find out patient has got second degree heart block. Second degree heart block is some P waves not followed by QRS complex. आता काय होईल पुढे? Here there is a moderate traffic jam. आता याच्या पुढचं ट्रॅफिक जॅम कसं असेल? कंप्लीट ट्रॅफिक जॅम. कंडक्शन मध्ये त्याचं कंडक्शन ब्लॉक, एसए नोड आणि एबी नोड मध्ये जे कनेक्शन असतात त्या कनेक्शन मध्ये देयर आर 3 इंटरनोडल फायबर्स. एक पुढून जातो, एक साईडने जातो, एक मागून जातो. इंटरनोडल फायबर, त्या तिघं इंटरनोडल फायबर्स मध्ये ब्लॉक असतो. So some P waves not followed by QRS complex is second degree heart block. In that you find missed bit, or I can also say skipped bit. What are symptoms patient will have? No symptoms. पण तो जर डॉक्टर असेल तर बघत बसेल ना, तो कुठं, he will not have missed bit. म्हणतो माझा हार्ट बीट मिस होतोय, त्याला कसं जाईल? Symptoms I'm talking about. Signs is missed bit. Whenever the beat is missed, at that particular point, if he stands up from a sitting position, काय होईल? कारण त्यावेळेस हार्ट कॉन्ट्रॅक्ट होत नाहीये, एकदम ब्रेनचा ब्लड सप्लाय. सो ही विल हॅव अ सिन्कोपल अटॅक्स. ही विल हॅव इंटरमिटेंट गिडीनेस. तो म्हणजे की मी जेव्हा पण असं झोपेतून उठतो, माझं डोकं असं गडगडतं 2 सेकंदासाठी, मी नॉर्मल होतो. बऱ्याचदा हे एक्झाम पिरियड मध्ये पण होतं, बऱ्याचदा हे वायवा मध्ये पण होतं. बट दॅट इज नॉट सेकंड डिग्री हार्ट ब्लॉक. राईट? बऱ्याचदा हे लग्नानंतर सासूला बघितल्यानंतर होतं सिन्कोपल. पण त्याला वेगळी कारण आहेत. हा, सेरेब्रल, पण त्याला बरीच कारण आहेत. ते कॅन बी सेरेब्रल प्रॉब्लेम, सेरेब्रल एडिमा, ब्रेन इंजुरी, सिव्हिअर पेनफुल अटॅक किंवा व्हेझोवेगल सिन्कोपल अटॅक. बरेच गोष्टी त्याला. व्हेझोवेगल म्हणजे एकदम हार्ट रेट कमी होऊन जातो, व्हेझोवेगल सिन्कोपल म्हणतो आपण त्याला. बऱ्याचदा बिकॉज ऑफ ENT कॉजेस, त्याला बरीच कारण आहेत. बट इफ इट इज शोइंग इन द ECG, if the patient says मला consistent syncopal attacks आहे, just take out an ECG. Normal असेल तर ठीक आहे, abnormal असेल तर you have found out something, or just look at the pulse. You can find out there's a missed bit, and then you take out the ECG. Then you have collar up. I have diagnosed this in a pulse, and I'm seeing that thing in an ECG. मग आपल्याला मेडिसिन इंटरेस्टिंग वाटतं. See, a lot of people you see are so busy, so engrossed in solving Sudoku puzzles. बघितलं कधी ते इतके एनग्रोस होतात की त्यांना दुसरं काही समजत नाही. ते ब्लॉक्स काय एनग्रोस होतात ते बिकॉज दे अंडरस्टँड द पझल. नाव the idea behind medicine is you should be understand in a symptoms as a puzzle. पेशंट जेव्हा सिम्पटम्स घेऊन येतो, पेशंट तुम्हाला एक पझल सांगतोय की मला हे होतंय. मग तुम्ही विचारता कधी कधी होतं, म्हणजे तेव्हा तेव्हा होतं, कधीपासून आहे, मग हे काय होतंय, पझल आपण उलगडतोय. तुम्हाला कधी कळेल ते जेव्हा तुम्हाला कळेल मेकॅनिक्स काय सिम्पटम्स मागे. Then the practice becomes interesting. Patients become interesting. You will not take holidays. Otherwise, the whole life is a wait for Saturday, Sunday. Whole life is a constant wait. Now, this is a miserable life, according to me. So, Monday ala ki kadi Saturday yahi. Now, even if you are a millionaire and you wait for Saturday, you are as good as a beggar who is also waiting for Saturday. Then upon weekend of off. So, let's look at the third degree right now. First degree मध्ये काय झालं? Peer interval was prolonged. But every P wave followed by what will be the pulse? Regular, irregular? Regular. कारण P wave अंदर 12 कॉम्प्लेक्स आहे. सेकंड डिग्री मध्ये काय झालंय? टक 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 रेग्युलरली इरेग्युलर. थर्ड डिग्री मध्ये काय झालंय? इज ऑल्सो कॉल्ड कम्प्लीट हार्ट ब्लॉक. याच्यामध्ये काय होईल? Will the vehicle reach from Dadar to Bandra? That means P wave will be there or not there? Vehicle तो इकडनं निघाली ना? P wave will be there. Yes. QRS complex will not be there. Patient will be live or dead. But patient doesn't become dead. कारण काय होतं? AV node हा दुसरा ड्रायव्हर आहे गाडीचा. तेव्हा हा ड्रायव्हर काम करत नाही, तेव्हा हा ड्रायव्हर काम करायला लागतो. That means when the impulse doesn't reach to the AV node at all, AV node generates its own rhythm. AV node, but the rate of firing मी काय म्हटलं होतं? याची 80 आहे, याची 40 आहे. Let's. That means will you get QRS complexes? How much late? There is the first degree heart block. Will you get a QRS complexes? So P wave will be at the rate of what? 80. P wave will be at the rate of 80 beats per minute. QRS complex at the rate of 40 beats per minute. But will there be any relation between these two? कारण यांच्यामध्ये काय कनेक्शन आहे का? म्हणजे P wave will be at the rate of 80, QRS complex will be at the rate of 40, but there won't be any relation between these two. म्हणजे लेट्स से काय नाही, कधी कधी फॉलो, कधी कधी अगोदर पण येईल, कधी कधी एकमेकांवरती पण येईल. Now understand, let's say two people are beating the drum. One person beating at the rate of 80, other person beating at the rate of 40. There is no, both of them are not listening to each other. म्हणजे होऊ शकतं की याचा ड्रम आणि याचा ड्रम सोबत पण वाजेल, अगोदर पण वाजेल, तर नंतर पण वाजेल. इज इट रिस्की? इज नॉट रिस्की. का? कारण जर एकमेकांवर वेव्ह पडल्या तर एट्रिया पण कॉन्टॅक्ट होईल आणि व्हेंट्रिकल पण कॉन्टॅक्ट होईल. हार्ट रप्चर होऊ शकतं. पण एट्रियल कॉन्टॅक्ट होताना एट्रियाचं ब्लड व्हेंट्रिकल मध्ये जायला पाहिजे. पण व्हेंट्रिकल पण कॉन्टॅक्ट होत असेल तर वॉल उघडणार नाही. This is called as complete heart block. This patient requires a pacemaker of the heart as early as possible. It's a complete heart block. ECG कसा दिसेल? That is what is important. How will the ECG look like? How will the ECG look like? It's a P wave at the rate of 80 per minute. QRS complex किती P wave आहेत? 1, 2, 3, 4. किती QRS आहेत? पण हे P wave QRS कॉम्प्लेक्सच्या नंतर आलाय. सॉरी, QRS कॉम्प्लेक्स P च्या नंतर आलाय. इथे एकमेकांच्या वरती आलाय. कारण दोघांमध्ये काही रिलेशन नाही. आणि हे सगळं आपल्याला कुठे दिसेल? Where will you get this? Long lead 2. You will get this on a long lead 2. This patient requires pacemaker. This is called as complete heart block. Called as a complete heart block. पप्पा हिना बोला दुसरा कॅमेरा हे ना ठेवलाय बघ मी चार्ज करून सॅमसंगचा आहे. So let's summarize the heart blocks. कुठे होतो आपण? First degree heart block, prolonged PR interval. Second degree heart block, skipped bit. Some P wave not followed by QRS complexes. Third degree heart block, complete heart. मग दुसरा ब्लूटूथ पण दे तिकडेच आहे तिथे पांढरवालं आणि कनेक्ट करून दे हां इकडे राईट जागा पुढे. This is what is called an atrioventricular blocks. You want to break? 2 minutes. नाही ना हां नाही नाही मला काय नाही नाही मला काय प्रॉब्लेम नाही हे जोपर्यंत आहे मला फक्त तो चेंज करायचा बाकी काय नाही. इनफॅक्ट इट इज नो ब्रेक माझी लिंक ब्रेक होणार नाही. आय एम गोइंग टू बी जाऊया पुढे कुठपर्यंत आलो आपण. पी वेव वी हॅव लर्न पी आर इंटरवल वी हॅव लर्न. लेट्स गो टू द क्यूआरएस कॉम्प्लेक्स. नाही KDM2 आहे हे ऑन कर ना. हां ऑन झालं ते KDM2 आहे वो निकालेंगे